My name is Tina Rodwell and I have a son who has myalgic encephalomyelitis, or ME for short. He first became ill when he was 8. He was given cognitive behaviour therapy and graded exercise therapy when he was first ill, which took him from 70% to bedbound. And I want to be able to show you what activity actually does to an ME person and the cycle that they go through each time they try an activity. So this is my circle of PAINSS. It stands for post-activity increase in new severity of symptoms. And I'll take you on a journey that my son recently went for his 13th birthday. I'd got him at a baseline, which meant that his ability and his symptoms were at a stable rate. And we were then going to go away for a weekend and he was going to have a quad bike. Now, we had to stay in that state for a good 4 to 6 weeks beforehand. The trouble was, he had a tutor lesson that went on longer than anticipated with too much fun happening, so he was already elated and excited. And then we had a nice day come along and he wanted to help me clean the patio because he's that sort of person. So we had tried to stay at baseline but couldn't achieve it because he had a tutor which sent him in the red area. We got to about the yellow area where he was getting back or at baseline and just needed a few days rest time, and he did the patio which swung him round here. And this is what happens if you try activities before the body has rested enough in a baseline rate. And I find it good to track their ability down on something similar to this, which I'll go through a little bit later because I can't fit it in one video. It won't let me download if I'd go over 15 minutes. So we were already in the red zone when we'd set off. Travelling is very difficult for Angus and that has a major impact on him, but was becoming less so. So I was I didn't anticipate too much of a decline, and I knew the quad biking would have a big impact. So we travelled down there, he rested that evening, his symptoms were already elevated, and then we went for this 40-minute quad bike, which was in the afternoon because that's his better time. When he came off, he could no longer see, his legs wouldn't walk as you would normally do, they were like this more, and he was going off to the right hand side. He wanted to express his enjoyment and tell us about it, but he couldn't, and we had to guide him to the car. He rested up, he's eventually got his vision back to more normal, and we rested the next day as much as we could, and then we came home. So that whole activity should have been well paced. He rested in between, but really in essence what had been happening is that he was doing more things and then he was going back up, doing something else and then going back up. In the beginning, when I first started this cycle or tracking him on the circle, that cycle would take him a month. We're now, for any activity, we're now down. When a tutor comes round, that normally takes him about 3 days. But because we've had such a big hit on all of his senses, we're 4 weeks on and he's still not able to get back to baseline. In the next couple of videos, I'll take you through how I track spontaneous wake time, because that's very important. If you wake a child in the morning, say, to go to school, that puts them into the cycle of PEM even before you start getting them dressed. Some people sleep for extended periods of time, say like 20 hours plus. Angus doesn't have that particular problem. His problem with sleep is getting off to sleep. He can't rest his mind enough and he's in too much pain a lot of the time to get his sleep. But sleep is very important to track. Also, it's their ability to do daily tasks like sit up and be able to do homework, or empty the dishwasher. So it's feet on the floor, whether you're sitting in an upright position or walking around. That upright position is the important bit. And then you have your sensory. So when you're doing an activity, say like, I think the best way to describe it is you're having a friend round for them to watch a film or a TV programme. They've got the excitement of somebody coming to see them in the first place. But when the people get there, they have a meet and greet, and cognitively that will engage them in thinking what that person is going to say, how they need to respond. They're much more animated when they have a friend around, speaking and moving around, because they're trying to keep up with the ability of the other child, and I'm sure they remember how they felt before they were ill. And then you've got the sensory. Say you bring in some new sort of snacks for them to eat, you've got a different smell there. You also have the program or the film that comes and gives moving images, which is another cognitive, and you've got the impact of sound. So you're not doing one activity, you're doing many activities in one bigger activity, and doctors and researchers don't really appreciate how that affects your child when they do that. So really the message I want to get over, if you allow your child to go through the cycle and the circle and you track their progress and how long it takes, you can eventually find your own pace and your own speed in order to allow your child to paint their own picture to give to a doctor or any of the supportive people like social services or education, so that they can see for themselves what impact an activity has had. And not only an activity, say you want to try a new treatment, by tracking it and seeing how that affects their symptoms and their senses, and also if it helps them get quicker around the circle, then that's obviously really helpful for everybody to know. So the circle of pain shows the body's cycle of dysregulation after activity. No child would be able to mentally or physically do that cycle without it actually being a natural rhythm of their body. So this is actually happening because their body is making it happen. Not to track someone's decline or to hide the fact that this illness can be very severe if you do not manage activity is unforgivable. To tell anyone this illness is a belief or a mental health problem is an abuse of the facts of science and an abuse towards the person suffering and their experience, and causes misdiagnosis, because if you've got orthostatic intolerance or post-orthostatic tachycardia, you're not going to get that diagnosis. Somebody's dismissing symptoms. It denies the ME sufferers treatments that can help with some of the symptoms and causes conflict and discrimination of the highest level. It denies them proper respect. Cognitive behaviour therapy is a passive-aggressive approach that should be taken out from the National Health Service due to the abusive way it has been used against children and their parents with regards to ME. No one hears or listens to us, and you need to. Clearly, Angus works hard at just coping with 101 things that cause his symptoms to increase to severity and sensitivity. I would say that this passive-aggressive reprogramming of the mind has tortured my son and family, that he deserves massive respect just as much as somebody with a visible illness or one with a visible treatment. Remember, the PAINSS trial, which reinvented the terms and the conditions that we now live under, will be known as the biggest medical scandal of our time. Carol Monaghan, MP, is calling for parliamentary debate into ME and the PAINSS trial researchers. I hope after listening and understanding PAINSS you will offer her full support. I sincerely hope NICE hear our plea and take our concerns on and get rid of cognitive behaviour and graded exercise therapy with regards to ME, so that no other child is harmed, and they learn to track the decline and journey of an ME patient and take notice of it. But no one again abuses their guidelines and the facts about ME. Thank you.